San Jose residents brace for a significant sales tax surge, 10% on the horizon. In a pivotal move, the supervisors of Santa Clara County reached a unanimous decision on Thursday, urging the community to endorse new sales tax measures that could push half of the county into a double-digit tax bracket. This proposed sales tax hike will be presented to voters on the ballot for the upcoming November 4th election. Notably, Thursday marked the final opportunity to incorporate additional items into this ballot, which will also feature a special election for the county assessor. To enact the tax increase, a simple majority from the county electorate is sufficient, since this is an unrestricted tax that can be allocated for any governmental purpose within the county. County officials have indicated that the increased sales tax is crucial to bridging a staggering billion-dollar budget deficit, which they attribute to the impact of the federal government's controversial Big Beautiful Bill. If voters approve the plan, the sales tax across the entire county would rise to 9.75%. Specifically, residents making purchases in cities like San Jose and Milpitas, which impose their own city sales taxes, would face a total tax rate of 10%. Meanwhile, buyers in Campbell would encounter the highest rate in the county at 10.5% if the proposal garners enough support from voters, while Los Gatos consumers would pay a tax rate of 9.875%. For practical context, this new sales tax would translate to an additional $187.50 on a $30,000 vehicle purchase and add $1.25 to a $200 retail transaction that isn't exempt from taxes. On August 7th, the Santa Clara County Board of Supervisors convened an emergency session after a report from Metro Silicon Valley revealed that approximately 30% of the county's budget is now threatened due to cuts in federal health programs, specifically Medicare and Medicaid, which are distributed by the state as Medi-Cal. Santa Clara County Executive James Williams projected on Thursday that the county's revenue could suffer a staggering $1.3 billion decline by the fiscal year 2029 to 30. He mentioned that the proposed additional sales tax of 0.5 cents could generate over $330 million in revenue over the next 5 years, around 70% of the public health care system in the county, which has seen significant growth in recent years, is funded by Medicare and Medicaid programs. Williams emphasized, "What we are witnessing is truly a national reflection, impacting California and our own county, leading to the loss of health insurance for thousands of individuals." He added, "Significant implications include cuts to directed payments and supplemental funding across various healthcare initiatives, which are designed to maintain access to services provided by hospital systems, such as ours. For instance, H.R. 1 has immediately halted any increases in those essential payments." A recent legislation, Proposition 35, which California voters passed in November to enhance Medicaid funding, will be rendered ineffective due to the immediate consequences of H.R. 1, according to Williams. It's imperative for state leaders to address the financial deficits faced by counties like Santa Clara to ensure adequate support. County Board President Otto Lee remarked, "H.R. 1 has created a substantial hole in our safety net. Our county manages 4 hospitals and numerous clinics while also supporting community health centers." To clarify, Medicare is a federal health insurance program designed for individuals age 65 and older, including younger adults with disabilities, while Medicaid serves low-income children and adults. Medicaid is the largest source of federal funding for the county of Santa Clara, contributing approximately $1.9 billion to its annual budget. Santa Clara County's strategy, the three-pronged approach. In light of the impending budget crisis, Williams revealed a strategic three-pronged approach his administration has devised, focusing on 3 main areas. 1. Building partnerships with state officials. 2. Restructuring services within the county's hospital system. And 3. Securing public support for the proposed sales tax initiative. The Valley Healthcare System serves as the primary medical provider for about 1 in 4 residents of the county, and during Thursday's meeting, numerous healthcare workers expressed their concerns regarding potential service cuts that could degrade the quality of care. Williams assured the attendees that this strategic approach is vital to maintain service levels at the Valley healthcare system, which encompasses 15 hospitals and clinics. However, advocates for the homeless and healthcare sectors have voiced worries that the recommended service reductions could further jeopardize low-income families. Esmeralda Virelis, a community outreach officer from Destination Home, stated, "These federal cuts might compel the county to eliminate vital programs across every sector that ensures stability for individuals and prevents homelessness before it starts. We strongly urge the advancement of the proposed sales tax. It is crucial that we explore all options available to safeguard these essential services." Williams declined to outline particular spending details during Thursday's meeting, but did mention that the supervisors will begin discussions regarding the 2026-27 budget in October. "It is important that we make a commitment today to our voters that significant changes will occur in our financial management," expressed District 5 Supervisor Margaret Koga.
The state sales tax currently stands at 7.25%, with additional levies imposed by county governments and numerous cities. In the Bay Area, sales tax rates range widely, from as low as 8.625% in San Francisco to as high as 10.25% in Alameda County. Here, consumers purchasing goods in cities like Alameda, Albany, Newark, and San Leandro face a tax rate of 10.75%. At present, over 65 cities across California have sales tax rates of 10% or greater, with 47 of them located in Los Angeles County. Should the proposed tax rate for Santa Clara County be approved, it would align with the existing rate in Los Angeles County. Currently, the city of Lancaster in Los Angeles County holds the record for the highest local sales tax rate in California, at an imposing 11.25%, according to data from the California Department of Tax and Revenue. As counties confront similar budgetary challenges stemming from the federal Trump's administration policies, it remains to be seen whether they will also raise taxes to avert severe service reductions. Barry Holtzclaw contributed to this report. What do you think about the proposed tax increase? Do you believe this is a necessary measure to maintain essential services, or do you think there are alternative solutions? Share your thoughts in the comments below.